Thank you very much. Boy, those lights are really, really bright, aren't they? I'm now going to forgive Mark for not acknowledging me in the room because I wouldn't have been able to see me either. But can I actually just acknowledge Mark and say that, you know, there are many things in the political sphere that you get the opportunity to have a red-hot fight about on a partisan manner. But one of the things that Mark and I absolutely 100% agree on is that this is not one of them. And we share a common passion that we have to all collectively do better to make sure that we don't hear what I heard from this man down here, I think Richard Vines, on about day one after being appointed as the Shadow Minister for Health. He said, in this country, if you're going to get cancer, you just need to make sure you get the right one. And I thought, my God, what a thing to say. And I think I've repeated that everywhere I've gone because it was probably one of the most defining moments in my short time in the health portfolio, because it made me realise that as much as we claim that we have equity in our healthcare system, it is really challenging when you get somebody of Richard's stature and understanding making a comment like that. So can I just say, I've been here before. I think this is the third time I've had the opportunity to speak to you. Can I just say, even though I can't say I see you because I can't, I hear you. I absolutely hear you, and I understand where you're coming from and that we need to do better. One of the things, obviously, that we have been waiting on with great interest is the HTA review, because the reality is that unless we actually have got a mechanism by which we can have early intervention, early diagnosis and access to targeted treatment, they're just words written on a page. And I know, you know, I'm absolutely committed to prevention and early intervention and making sure that we have treatments that give Australians the best possible opportunity to deal with their diseases as early as possible so that their condition is not worsened by the lack of treatment, and making sure that we are getting targeted treatments, particularly world-leading treatments, to Australians as soon as possible. So I'm very, very keen to see what comes out of the HTA review, because without that mechanism, we do find ourselves in a situation where perhaps the rhetoric isn't matching the action. So I wait with great interest, and hopefully Mark will have the opportunity very soon for us to be able to all have a chance to have a look at what those recommendations are, so that we can collectively work together, so that we can get the easiest, best and quickest access in the safest possible way for Australians to be able to get access to treatment. Can I also acknowledge that the issue that we talk about here in terms of getting Australians access to support when they have a cancer diagnosis is not just clinical, and that we all need to do better around understanding the broader implications, the psychological impact on the individual, but also the impact that it has on the families. And, you know, particularly when we're dealing with younger people and children who have a cancer diagnosis, and understanding that the impact that that diagnosis has on the broader family, the impact it has on siblings and their development, and that there is a broader piece around the wraparound services that we really do need to make sure that we are delivering, hand on heart, the best possible care that we can to Australians who find themselves, unfortunately, with a cancer diagnosis. But can I just say thank you very much. You know, it's amazing the work that you do, and acknowledge all the amazing people in the room today. There's too many of you to mention. Mark very cleverly tried to get through all of your names, so I'll associate myself with his remarks in that regard. But just to say, well done on this report. It is through the advice, research and investment of what goes into reports like your report today that help governments make policy decisions and oppositions to decide which of those policies that they want to adopt and accept. And clearly what's, you know, with this particular report, you know, about making sure that we do have an equity proposition for Australians is just so terribly important. So thank you for the opportunity to be here today, and I look forward to continuing to work with you. Can I say that if I'm ever fortunate enough to be the Health Minister in a future government, I'll speak to the Defence Minister and I'll make sure the flyover is for you. Thank you.